This program contains graphic scenes of medical procedures and nudity.
When you undergo surgery, you expect to be treated with dignity and respect. But inside some cosmetic surgery clinics, patients would be shocked to see what really goes on.
It is dangerous, disrespectful, it is bewildering. If you didn't show me these people, you'd think, oh, this can't be happening in Australia. And here it is, you're showing me. Where have we gone so wrong in Australia that these two individuals think that this is acceptable, think that this is reasonable, that this is fair game?
Australians spend billions of dollars on cosmetic procedures every year. It has spawned an industry that is largely unregulated and in some cases seemingly out of control. For some patients, it ends badly.
I've never had such agony in all my life.
It's ruined a huge part of my life.
It was beyond my wildest imagination that a medical clinic in Australia could operate that way.
Welcome to the Cosmetic Surgery Show!
Cosmetic surgeons have become media celebrities and multi-millionaires.
To take us through the best age-defying procedures is our cosmetic surgeon, Dr Daniel Lanza, who joins us from Melbourne. Scrubbed up, Dr Lanza, good to see you.
But behind the scenes, there's an entirely different story to be told.
I've never seen anything like this. It's staggering.
This is not trivial. It's significant. It's serious.
It was such a horrendous procedure.
Horrendous.
I would describe the cosmetic treatments industry as like the Wild West, but without the sheriffs.
Tonight, in a joint investigation with the Sydney Morning Herald and The Age, Four Corners goes behind the glitz and glamour of the cosmetic surgery business. We look at a litany of questionable surgical practices and expose a regulatory system that's failing to protect patients in this multi-billion-dollar industry.
We love to stand out, but we don't want to look unusual. We want to look attractive, but not freaky.
This is Dr Daniel Lanza. He's Australia's most famous cosmetic surgeon. Dr Lanza is a dermatologist who's learned, like many, that the big bucks are in cosmetic surgery. He owns day hospitals in Melbourne and Brisbane, facilities in Sydney and Perth, and is opening a chain of skin clinics. He has a large portfolio of residential and commercial properties worth many millions of dollars. He works hard on maintaining a high profile.
I was lucky as a dermatologist to be there at the forefront when many of these procedures came out, and I was able to take it to a new level.
Tonight.
Dr Lanza regularly appears in the media as an industry expert.
Cosmetic surgeon Dr Daniel Lanza.
And Dr Daniel Lanza joins us now.
As you know, cosmetic surgery in men has really dramatically increased.
His latest frontier is social media. He's one of TikTok's most followed cosmetic surgeons in the world. His 5 million TikTok followers and 300,000 Instagram loyalists can't get enough of him.
Thank you, 300,000 followers. I'm so proud that I can share all this wonderful surgery together with you every day. I've consulted many adults who are deeply appreciative that they've found out about methods of cosmetic surgery via TikTok and Instagram. They're so appreciative that they can see real surgery, real patients, and real results.
So we embarked on this year-long journey of looking at cosmetic surgery and how it's being advertised to people online, and also at some other issues in the industry.
Madison Johnston and Michael Fraser are consumer research advocates who've collected thousands of videos posted by Dr Lanza and his associates.
When we started, there was so much video content, there was so much to watch that we actually couldn't watch it all, so we wrote software to watch the videos for us and find things that might be interesting.
We found that they were some of the most followed people in Australia and possibly the most followed cosmetic surgeons in the world.
The area of social media when it comes to cosmetic surgery is like the wild, wild west. It's just out of control with very little oversight.
We're just two people, we're just two advocates, so we're wondering why it's left to people like us to monitor this and audit this when there's a regulator who's supposed to be doing it and flagging it to protect the public from harm. Why is that falling to the public to do? Isn't that the job of the regulator? Where are they?
Good morning, everybody. Happy having a great day, surviving COVID.
Dr Lanza records almost everything and shares it freely on a range of social media platforms. In this video, while he's performing liposuction on a patient, he's reprimanding staff for not picking up the phone enough.
Because I'm getting all these emails and WhatsApps where people say, so nobody got back to me, and I rang 5 times, and not good practice at all. And so many people are coming in and saying to me, you're great, but your back end is shocking. It never was like that. I know we're busy.
We showed this video and others to 3 esteemed plastic surgeons. This is Professor Mark Ashton, the former president of the Australian Society of Plastic Surgeons.
I know we're busy, but obviously we need to work together, so can we set up that today, please?
In the 4 sentences I saw Dr Lanza talk to the camera then, he didn't have any idea where the tip of that cannula was. You need to visually, directly look at where the tip of that cannula is at all times. That's surgery 101 that you learn in the first week of training.
This is Dr Craig Rubenstein and Dr Patrick Briggs.
He's not watching what he's doing. Is that...
One of the risks of liposuction is penetration through the abdomen into other organs such as liver, kidney, and even the aorta. To be using a cannula, not actually watching where that cannula is dangerous.
This is incredibly dangerous.
Another video shared on social media shows some of Dr Lanza's colleagues singing and dancing while performing liposuction on an unconscious male patient. We've chosen to obscure their faces.
These 2, I'm not even going to call them surgeons, these 2 gentlemen are not even watching where the tip of the cannula is going. It is dangerous, disrespectful, it is bewildering. If this was not true, you'd think, OK, this can't be Australia. If you didn't show me these people, you'd think, this can't be happening in Australia. And here it is, you're showing me. Where have we gone so wrong in Australia that these 2 individuals think that this is acceptable, think that this is reasonable, that this is fair game?
Dr Lanza told Four Corners he reprimanded the staff involved in this incident. Dr Lanza claims to have thousands of happy patients, but he also has some very unhappy ones. Donna Patterson has spent 21 years living with the mental and physical scars of a breast reduction procedure she should never have had.
He caused me extreme pain, housebound. I had to have further major surgery twice because of his procedure.
She sought the procedure not for cosmetic reasons, but to cope with congenital back pain.
I have scoliosis, which is curvature of the spine.
She was told reducing the size of her breasts would help alleviate this problem. She'd seen Dr Lanza in the media spruiking his brand new procedure that he claimed was much less invasive and used liposuction rather than surgery.
In the year 2000, someone pioneered a new procedure to reduce the volume of the breast, and it's called the liposuction breast reduction. And that surgeon is in this room, actually, Dr Lanza.
We're looking for fat. So the way I look for fat is I feel to see if it's fatty.
I thought, oh wow, you know, it's promising a 3-day turnaround, you know, back to work in 3 days.
For Donna, the procedure was a disaster that left her with debilitating pain.
I couldn't work, I couldn't study. I was taking lots of pain medication.
How long did the pain go on?
Oh, years. Years and years.
Donna saw a plastic surgeon for corrective surgery and ultimately took Dr Lanza to court. The court found he was either negligent towards Donna or had breached his contract with her and ordered him to pay damages. And then he appealed. How did you feel?
I was shocked. I was shocked, yeah, because, you know, the evidence was straightforward.
Donna won the appeal.
Unanimous, you know, 3 judges agreeing that, you know, there was no grounds for appeal. So here I am, still worrying that it could happen to somebody else again.
Four Corners sent questions about Donna Patterson's case to Dr Lanza. He replied on video.
One of my greatest achievements was to pioneer the method of breast reduction for women with large, heavy breasts through liposuction alone via tiny nicks rather than the big, long cutting surgery. However, this set off a turf war between different surgical specialties. After the court hearing, this dispute went to the Medical Practitioner Board of Australia, and they ruled in my favour, and they told me that they had informed Donna of the results. I'm happy to advise that my method now is an accepted surgical option for breast reduction all around the world.
These photos provide graphic evidence of the methods used in Dr Lanza's clinics. To save time, he and his doctors sometimes use staples rather than sutures.
I've been doing facelifts for 30 years, and I've never seen that before.
It's going through the cartilage. Oh dear.
We never use staples on the face in front of the ear. It's such a delicate, such an cosmetically sensitive, important part of the face. It's the part of the face that the community, their husbands, their lovers, their kids, their family, their friends see every single day.
I use a combination of sutures and staples. This study that was published in the Archives of Trauma Surgery 2020 shows that the cosmetic results is identical for sutures and staples. As a skin specialist, I have a great passion to obtain the least scarring as possible, and that's done by reducing the tension on the wound as much as possible. The advantages of a staple is that it grabs the skin deep and takes the tension off the top layers, and there's actually almost no redness and irritation, which is the cause of scarring. It's important to remove the staples early. I've tried many methods over the last 30 years, and I've not found anything as effective as combining sutures and staples to give the best cosmetic results, especially the new staples that are actually hidden under the skin and dissolve themselves.
This woman had staples from one side of her belly to the other after a tummy tuck. She works for Victoria Police. She's agreed to share her experience, but asks that we protect her identity for professional reasons. How would you describe your experience with Dr. Lanza?
I felt like as soon as I walked into the operating theatre that I was in a cheap, dirty operating room.
The policewoman says she took these photos in Dr. Lanza's Melbourne clinic.
When I walked over to the bed, there was dirty blood stains from another patient on that bed. Blood on the curtains, blood on the table, just disgusting.
But then it was too late.
Absolutely, because by that time you've paid.
Dr. Lanza arrived and started filming with the woman's consent. He posted the footage on Instagram.
He started to do the markings on my stomach.
All right, today we're going to do a full lipo tummy tuck. Now, sometimes I choose that because the skin is too droopy and they don't like this skin texture and this hanging. But we're going to cut from all the way very low down right up to here. So it's a big cut. We're going to remove the belly button, bring a new belly button through the new hole, and bring that skin down to here. She's very, very, very aware that this is more risky. She wants to go this way. Let's do it.
The policewoman was shocked when she later saw the footage on Instagram. Four Corners has added the blurring.
Do you like the look of skin separating?
He's got his hand in there, inside my stomach during the surgery.
Notice we've made a flap right up on that upper part of the stomach. Here's our belly button. Here's the hole where it used to go through. We're going to pull the skin all the way down and make a new hole up here to bring the belly button out. We're going to bring this skin together.
6 weeks later, Dr. Lanza is pleased with the result.
All right, I'm really excited to show you this result. This we did 6 weeks ago. She was on our Instagram. Remember, she was a full tummy tuck.
This is the policewoman's scar 9 months later.
I had to go to a plastic surgeon. I had to then have labiaplasty because he had pulled the bottom of my stomach up so hard and tight that it was then uncomfortable for me in my labia area. The reason I have all these extra big lines here, you can still feel all these hard lines, is still the stitches on the internal that keep poking out. When I went to the plastic surgeons to get fixed up, and both of the different surgeons I consulted said, why? Just explain why you ever went there. And it was just the hype.
Dr. Lanza has a standard response to patients who complain.
For all new staff, remember, if somebody rings up, they're not happy, they didn't like the nurse, they didn't like the doctor, they didn't like the dressing, they've got a wrinkle, whatever the concern is, doesn't matter what it is, there's only one answer. If you say anything else, you just wasted your time, you didn't do a good service. The answer is, hey, did you know that Dr. Lanza cares? He's the most caring doctor in the whole world. He'll want to know about that. All the surgeons, they're so caring. I've been around the world and I've never seen doctors like they care, they want it, I'll get on to them, they'll be back to you straight away. So important to them. Thank you for bringing up this, but they care.
Registered nurses Lauren Hewish and Justin Nixon both resigned after working for Dr. Lanza for 18 months. They both feel compelled to speak out at great personal risk.
You know, I have done, some not so ethical things for a surgeon. I had done stuff that has gone against my own registration, against my own competencies. So speaking up, it's scary because, I could lose everything.
And yeah, it was guilt that weighed on me, having sold people these shitty outcomes. It's absolute chaos. Multiple surgeries running throughout the day, doctors going from room to room.
So is it like a factory?
It's just bloody, messy, gruesome, chaotic. Yeah.
People are just pushed in and out. Blood everywhere, fat everywhere. As a nurse, I have a duty of care to advocate for my patients, and that is your number one priority as a nurse, is to advocate for your patients and their safety and their well-being.
Cosmetic surgeons are not plastic surgeons. Under the current law, dermatologists like Dr Lanza or GPs or anyone with a basic medical degree can call themselves cosmetic surgeons. Plastic surgeons, on the other hand, have received at least 12 years of medical and surgical training.
People can use the term cosmetic surgeons with gay abandon, provided they've met the minimum requirements to be a medical practitioner.
Dr Robert Sheen is the president of the Australasian Society of Aesthetic Plastic Surgeons.
We have done a consumer survey and we've found that 81% of respondents believe that when a practitioner uses the title cosmetic surgeon, that practitioner must be a registered specialist in cosmetic surgery. We've also had testimony from patients who have had adverse outcomes at the hands of these cosmetic surgeons, and the patients have said afterwards, if only I'd realised my doctor was not a registered surgical specialist, I would never have gone through with the surgery.
Plastic surgeons have been campaigning for greater regulation of cosmetic surgery for decades.
Everyone agrees that this is a preventable problem, and everyone agrees that AHPRA needs to be taken to task in order to ensure it does its job properly, which is to protect the public.
And who allows this to happen? How does this happen?
This happens because the regulator, that's AHPRA, have chosen to allow it to happen.
AHPRA is the Australian Health Practitioner Regulation Agency, the watchdog for medical professionals. We requested an interview with the head of AHPRA, Martin Fletcher. He declined, but couldn't escape a grilling at a Senate hearing.
Are there any practitioners that you're investigating currently, Mr. Fletcher?
In relation to cosmetic procedures?
Yes.
I couldn't tell you that off the top of my head. I'm sorry, Senator.
Is there anyone who can assist you with that? Because I'd be pretty surprised if you're not investigating someone, given how much she's botched.
Well, I'll ask Mr Hardy, but I suspect we'd have to take that on notice in terms of the details of that. But did you want to comment, Mr Hardy?
Briefly, Senator, yes, there are practitioners who are being investigated in circumstances where a patient is unhappy with the outcome of a cosmetic procedure undertaken by a practitioner.
I just express grave concern for the continuing practice. Somebody today will be sitting outside a billboard that says cosmetic surgeon inside, and they will absolutely believe that they're going to get surgery by somebody who's a skilled specialist. And I cannot believe that that is allowed to stand.
Cosmetic surgery is not currently a recognised special area of specialist practice under the national law. It's not a protected title. Therefore, we cannot stop someone calling themselves a cosmetic surgery, but we can regulate the practice of somebody who calls themselves a cosmetic surgeon.
AHPRA made another disturbing concession.
Even though the protection and safety is the prime job of AHPRA, really they can't protect the public until the public get hurt. So that doesn't make sense really in terms of protection, because it's a reactionary agency.
It is right. It is completely reactionary, complete.
The Australasian College of Cosmetic Surgery defends the regulator and claims the plastic surgeons are just trying to protect their own turf.
AHPRA are acting properly and they are acting effectively for three reasons. Firstly, surgeon is not a protected title. Secondly, cosmetic surgeon is not a protected title. Thirdly, cosmetic surgery, as we've said earlier on, is not a specialty. Therefore, AHPRA are acting quite properly and quite effectively within the jurisdiction under the national law as it currently stands.
Is the system keeping patients safe?
Oh, in the context of cosmetic procedures, absolutely not. The system as it stands right now for cosmetic treatments and procedures is completely unable to keep patients safe.
Dr Margaret Faux has spent years researching the regulation of the health system.
Basically, the government has no eyes on what happens in the cosmetic sector. This entire regulatory framework needs a complete overhaul. It's basically lawless. It's like any other consumer market. You know, it's buyer beware, except that people's lives can be put at risk.
We share the view of our plastic surgery colleagues that unqualified, untrained doctors representing themselves as cosmetic surgeons is confusing and dangerous for patients. That pragmatic solution comprises three things. The first thing is to generate or to put a fire in the belly of the medical board to generate a register of cosmetic surgeons. In order for any practitioner to get on that register, they would have to meet an agreed, objective, transparent accreditation standard so that once they are on the register, anyone looking at the register can know that that person is trained, competent and safe. The third element of it is sensible title restriction. So people who are on the register, having met the accreditation standard, would then have that title protection.
Hygiene and sterility are the cornerstones of safe surgical practices. These photos show the contents of fridges in Dr Lanza's clinics.
This looks like a normal domestic fridge. There doesn't look to be any temperature control monitoring, and there doesn't seem to be any sterility. These bags are open, they're not sealed. A complete breakdown in acceptable standards of medical care. And the only place that needs to be is in a biohazard sealed medical bin.
It just goes against the grain for everything that we've learned whilst training as surgeons.
We have drugs which have been sealed with masking tape sitting right next to drinking water in a commercial fridge. This is not even close to acceptable medical behaviour.
I showed Justin Nixon a video we obtained of a storeroom in Dr Lanza's Sydney practice. What does this show you?
So if you look closely at the beginning of the footage, you can see that the surgical instruments, they're actually not sterilised on site, which they should be. They're actually just amongst the doctor's shoes and dirty clothes. So that's pretty horrifying. You can also see that the tumescent fluids and various medications that will be administered into the patients are drawn up in sort of unsanitary conditions.
I showed some of this to Dr Briggs, Dr Rubenstein and Professor Ashton.
Yeah. So I'll just bring your attention to this here. This is the instruments. So they were sterilised in Melbourne and they've been transported in the doctor's suitcase. So often it will be with the doctor's scrubs, their shoes. It's not safe or hygienic at all, and especially not to have it thrown in with the doctor's shoes and belongings. The tumescent fluid, which is the local anaesthetic agent, is actually drawn up and prepared in this dirty, filthy environment.
So they do medications in that?
Yes, so they organise all the tumescent fluid in the back room. This is from a fat transfer canister. Yeah, it's not uncommon for the fat I can recall on one instance where the fat had fallen down and got lodged in the floorboards, and there was a lot of ants eating up all of the fat. It was pretty disgusting.
It's disgusting.
And here, this is a bucket for the instruments, but yeah.
You're kidding?
Yeah, so we put the instruments in there.
On the floor?
I've never seen anything like this. It's staggering.
There is no sterility. There is no concept of sterility. And how this is allowed to occur is bewildering. I'll call it out. It's frankly dangerous. One of the major causes of death after liposuction is uncontrolled infection. And the only way that you can prevent that or avoid that is by having a very, very sterile, well-organised, clean environment in which you prepare your medications, in which you prepare your instrumentation for surgery.
The state health departments are in charge of checking whether cosmetic surgery clinics are complying with regulations. In Victoria, the Department of Health gives registered day procedure hospitals like Dr Lanza's 6 to 8 weeks warning of an audit. Safety and quality audits are also booked weeks in advance. This allows plenty of time to get things in order.
The auditor comes in and they see this lovely, empty, perfect theatre, but it's because all the stuff, all the clutter that was in there is in people's cars. Fat that is in fridges that shouldn't be stored in there is stored in nurses' fridges at home.
Nurses were asked to take fat home and put it in their own fridges with the intention of bringing this fat, returning it to the clinic, that it could then be reused and injected into people.
Staff would have to take it home.
So there'd be big bags or just shopping bags from Coles or Woolworths stuffed with syringes or bags, liposuction bags full of fat.
I have got no idea why we have fat sitting in an unsterile environment in amongst the drugs, which I presume are going to be injected into someone else at a later date.
Dr Lanza denies there's an issue with sterility at his clinics.
We have the highest standards of hygiene and safety, and therefore my infection rate over the last 30 years has been minuscule. We're audited every year by an infectious control nurse, and we've maintained that level of excellence since its inception. I do not think that there's a surgeon in the world who could show a better safety record than I've done over the last 30 years. In my 30-year career, I've never had a single ruling or recommendation against me regarding my method of surgery or my patient care by any regulator.
In December 2020, Jackie underwent liposuction on her neck by a doctor at one of Dr Lanza's clinics.
And so I really looked into so many people, and the reason I chose the Lanza clinic was because they advertise that they've been around for 30 years and they put themselves out there. They're validated by the media.
So take us through what happened on that day.
Well, everything went wrong from the beginning. There were so many signs, but I had paid them and I didn't know how to get out of it. He got me to lay down on the table and immediately started administering anaesthetic, which was extremely agonizingly painful. He didn't warn me what he was about to do. He didn't talk at all. He just started injecting me with anaesthetic, and I began to cry out with pain, and he just basically said, stop it, you're making it worse. And I tried to breathe and tried to control my pain by breathing and like a low groan. And he got annoyed and said, don't do that. Don't make a noise. It's better if you just be quiet.
Once the liposuction procedure began, Jackie's pain got even worse.
It was like having him punch my jawbone while he was doing it. I was crying in agony and he didn't stop and he just kept punching at the same place. I was in such excruciating agony that I could not think or feel. I just felt pain. All I could think is, I've got to get through this. I couldn't get up and run away. I mean, they had me lying on a table filled with anaesthetic liquid. It was like you trusted someone to look after you and you were suddenly in a position you hadn't seen coming. Not being able to move and feeling like...
Do you want to have a little break?
No. Feeling like you're so... I don't know how he can do that to people. I felt like I had to be strong and I had to not fall apart.
Jackie made a complaint to the regulator, AHPRA, which is investigating her case.
So I reached out to AHPRA, and AHPRA have started an investigation into them. But, you know, to be honest, I don't know how far that's going to go, because they have told me that the way the investigation is going, the doctors get to see my reports. They get to see what I say, but I don't get to see what they say back.
In a statement, AHPRA said, due to confidentiality restrictions, it could not comment on whether an investigation was underway.
Actually, my patients are really well informed that there may be stinging and pain if the patient chooses to be awake. The vast majority of patients do not feel pain, and if there is some discomfort, we've got lots of things we can give. I'm on a working committee together with the College of Anaesthetists to develop appropriate guidelines for sedation and pain during surgery, and therefore I offer my patients general anaesthetic, sedation or local anaesthetic. It's been shown that the safest method to perform liposuction is with the dermatologist's tumescent technique under local anaesthetic, and therefore it's the patient's choice if they want to be asleep or have local anaesthetic. So, Sharon, we've got a bit of a surprise for you.
Another procedure Dr Lanza spruiks is so-called megaliposuction, where more than 6 litres of fat and fluids are removed from a patient in a single procedure. Dr Lanza and his colleagues treat it like a reality TV show.
How much fat do you think we're going to sculpt out?
I don't know, 5 litres?
I think maybe 7. What do you think?
I think maybe 7.5. Okay.
Let's go.
25 past 8. It was about an hour and 15 minutes. We said, let's come to someone saying the patient said 6 litres. Said 7. I said 10. Let's have a look. 2, 4, 5, 6, 7, and 2 over here is 8, 9, 10 litres. 10 litres.
I'm pretty sure you said 7.5.
Did I say 7 or did I say 10? Please go back and check.
If this person went home after having 10 litres of liposuction, that is flat out dangerous. And it is avoidable. And this sort of macho bragging about how much fat you can remove shows a complete disconnect from the doctor-patient relationship.
Let's have a look. 2, 4, 5, 6.
It's just remarkable. It is staggering.
It's been a standard in the United States that you do not take out more than 5 litres of fat at any one time without hospitalizing someone so you can monitor their blood pressure and electrolytes.
I spoke to internationally recognised plastic surgeon Dr Lawrence Gray from the United States about the controversy surrounding megaliposuction.
It's very dangerous. There's many factors that there are fluid shifts that happen and you worry about someone's electrolytes. You can worry about fluid overload and patient having breathing problems and even cardiac arrest if you're talking about removing that amount of tissue.
I am a pioneer in large volume liposuction, which we called megaliposuction. There are very few surgeons in the world who use this method. I've performed literally thousands of cases over the last 30 years without a single serious complication. I've written a chapter in the book of liposuction about how to avoid complications. I've spoken in America about my method of megaliposuction at both the American Academy of Dermatology and the American Academy of Cosmetic Surgeons. Painful lipedema and obesity are serious issues, and there's a safe, life-changing operation in the hands of the right person, and I'm proud of it.
In November 2018, nurse Kathy Hubble attended Dr Lanza's Sydney clinic for liposuction on her legs and abdomen.
His standards were sub-poor. They were absolutely diabolical. And as an experienced theatre nurse, I could tell that he didn't meet any of the standards or the guidelines for a procedure room. Every alarm bell in my head was ringing. This was not a procedure room. I actually thought it was a change room when I first walked into it. It was so tiny. There was obviously no standards that they were complying to. I guess I kick myself now for not listening to my inner voice and saying, you know, don't do this. This is a disaster.
Kathy had 2 procedures over 2 days. Then the pain set in.
I got to the point where I couldn't sit, I couldn't stand, I couldn't lie down. I was in extreme distress and pain, and I've never had such agony in all my life, and I could hardly walk to get into the car. And my partner drove me to Gosford Hospital, where I arrived at the emergency department. A couple of doctors look at me and they were absolutely horrified, and they notified Dr Lanza that I was in hospital, and he then started ringing my mobile phone. He was trying to convince me to leave the hospital and go back to the clinic in Sydney, or he was going to send one of his doctors up to get me. The doctors did ultrasounds and scans, and they ascertained that it was actually cellulitis and I was bordering on septic shock. And the doctors that actually were looking after me were absolutely horrified of what had occurred, and the devastation and the extent of the cellulitis, which was literally from my navel to my knees.
Dr Lanza refunded Kathy the cost of her surgery, but she was told in a message it was only because he felt sorry for her, and was despite the fact that Kathy did not take the antibiotics prescribed post-surgery. So was there any truth to those comments that the reason you were in the situation you were is because you hadn't taken the antibiotics, you're working full-time, and you didn't take him up on his treatment offer?
There was absolutely no truth to any of it, and I flatly refused to sign any gag order that would stop me from complaining.
And you did lodge a complaint with the Health Complaints Commission?
Yeah, I've never heard anything from it, so I was actually going to follow it up, but in the end you just want to be rid of the whole scenario.
3 years after her procedure, Kathy is still suffering.
I now have chronic pain. The abdomen is now hard and rubbery, and the tissues are so damaged that I get nerve pain across my abdomen in flashes sometimes.
Dr Lanza provided this response in relation to Kathy Hubble.
I know the patient you're referring to in 2018 because infection is so rare that I know the patient you're talking about, even though you haven't told me the name. And unfortunately, complications do happen, and I'm sorry about that. But the key thing is, was the patient warned? And how did the doctor take care of the patient? So I've just looked through the patient's notes, and I can see on 8 occasions the patient was warned about infection, the most recent being where I stressed infection plus. So the patient knew that it's a risk, even though it's 1 in 1,000, it's so rare. I called this patient many times because I cared about her as a person, and I cared about her getting the best treatment.
It's seems one of Dr Lanza's key tactics is never to admit fault. This is an audio message he sent to staff.
Never, ever, ever, not slightly, ever, 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 ever admit to a patient that something's bad or wrong. They'll use it against you 100 times the rest of your life. You never tell a patient you're infected. No. You never tell a patient I haven't got gowns, gloves, this, that. No. This is how we do it. You do not own up to nothing. Zero. Never, ever, ever, ever own up to anything.
This is another audio message to staff.
And I never, ever, ever, ever want to hear any staff sending anybody to a GP. You page me first, okay? We can handle everything. Sending to a GP is the worst possible thing you can do, or to a hospital. Never, ever, ever. And it always creates problems.
Dr Lanza provided this comment to Four Corners.
I have a top general physician who's been an advisor to our practice for decades and can admit patients to hospital in the extreme rare occasion if it's required. You see, the procedures I perform are very specialised and not something that other doctors are familiar with, and it could really compromise their results. The best person to treat a possible complication such as infection is the treating surgeon, because he knows the procedure, he understands how the body should look, and most importantly, he's got the quick answers and sometimes a multifaceted approach to get things back on track.
There are further allegations about Dr Lanza's practices. Four Corners has obtained messages that show Dr Lanza has signed blank prescriptions for nurses to later fill out. This message is from a senior nurse. The DL refers to Daniel Lanza.
DL has left some signed scripts for emergencies. They will be kept in locked DD cupboard.
Yep, no, illegal.
Well, of course, a signed blank prescription would be worth a lot of money on the street to a drug addict.
Yeah.
We do not use blank scripts. I think you've been given false information in the example you mentioned. See, antibiotics are not a Schedule 8 drug, which is actually the classification for opioid painkillers. Our audited practice policy is to write scripts according to the guidelines of the Pharmaceutical Society of Australia.
There's also evidence the practice may have used medication that was out of date. A message from a senior nurse to staff in February 2020 says, "Please don't use new stock until the old stock is used. We have stock that expired in November and December 2019 that needs to be used first."
If they willingly and knowingly use an expired drug to inject into you, knowing that it puts you at risk, is dangerous, reprehensible.
I mean, drugs have an expiry date for a reason, and it can be due to toxic compounds, lack of efficacy. If you think something's out of date, you don't use it. You just don't use it. It gets discarded. I would suspect it would be illegal, actually. Yeah.
Earlier this year, Dr Lanza hosted a live chat with Dr Miami, a Florida-based plastic surgeon with his own TV show and huge social media following. They discussed the risks of cosmetic surgeons being sued.
Someone said in USA, everything can be a lawsuit.
I tell you what,
it's true.
You know, we're lucky in Australia. The government changed the law a number of years ago. You have to do something pretty bad to get sued. There's no such thing anymore.
In Australia, the legal and regulatory systems are failing to keep cosmetic surgery patients safe. Social media has helped trivialise the seriousness of these body-altering procedures. Cosmetic surgeons seem to be operating with impunity, taken to task only after the damage is done, if at all. Is Dr Lanza just one of many?
Dr Lanza is the tip of the iceberg.
I hope that this has an effect and that people can hear my story and If this stops one more person being hurt by those people, it was absolutely worth coming out like this.